Hello, my name is Haley Levenholtz. I'm going to be talking about preventative medicine and holistic care and nursing. What is it? According to the American College of preventative medicine is focusing on protecting, promoting, and maintaining health of the individuals and communities. Holistic nursing is looking at the whole person. It takes on a mind, body, spirit, emotion approach instead of merely focusing on the patient's current symptoms. Preventative medicine and holistic nursing go together because they both focus on taking care of the patient's overall health instead of focusing on one body system or symptom. I'm sure we've all heard these terms in nursing school, but I think it takes it a step farther going over it once you've graduated and have been working. The goal. The goal is to think deeper about whom our patients are, our people, versus a task or something we have to deal with. Instead of viewing our patients as something to resolve, we should see them for who they are. For example, instead of just focusing on their chief complaint, like abdominal surgery, we need to focus on the whole picture of how everything's related. A nursing diagnosis deals with the human response to potential health problems and life processes, whereas a medical diagnosis deals with the disease or medical condition. Hot topics right now are nutrition, exercise, aromatherapy, and other complementary medicine and spirituality. Nutrition. The major cause of death, illness, and disability include coronary artery disease, stroke, hypertension, atherosclerosis, obesity, diabetes, osteoporosis, dental caries, gallbladder disease, and dementia are all connected to diet and nutrition, according to the Australian government. Nutrition plays a role in how our patients feel. If a patient eats a diet full of fiber, they may feel less constipated or overall more comfortable. Protein can aid in the healing process and may help patients recover faster. A diabetic patient who is low in blood sugar may feel much better after drinking a glass of milk. Tip. Assess your patient's nutrition status and ask what kind of foods they typically eat at home. What do you normally eat? Do you normally eat bread, or do you normally eat only poultry instead of beef? Do they like the food at the hospital? Do recommendations need to be made to their diet to promote health? Maybe they're not eating a low sodium diet and they just got diagnosed with heart failure. Questions. Have you ever noticed on how you feel when you focus on nutrition? What are you doing for the health and nutrition of your patients? Overall, I'm just encouraging you guys to think a little bit deeper on interventions that can be made to overall help our patients have better health. Exercise. According to the American Heart Association, they suggest at least 150 minutes per week for moderate exercise, or 75 minutes a week for vigorous exercise. That can be 30 minutes a day, 5 days a week, or 2 to 3 segments of 10 to 15 minutes a day. My encouragement with that is, if you have patients that are inside the hospital, are you encouraging them to exercise by walking in the hall several times a day? Things like that. We can be doing that while they're in the hospital, not just encouraging outside of the hospital. According to the Harvard Medical School, regular exercise can be made to make changes to the brain to improve memory and thinking skills. It has been suggested that there is an increase in brain regions with regular exercise. Exercise can relate to cognitive impairment by reducing stress and anxiety. Exercise can also increase gastrointestinal motility. Gastrointestinal motility is especially important for patients who have had a history of constipation, small bowel obstructions, and who have had surgery because it can encourage bowel movements. Especially with our patients that have surgeries, walking is going to help them a lot, especially with narcotics that they're taking, or if patients are on the medical floor for pneumonia. Walking will help their lungs function, help their pneumonia to get better. Questions. Are you ambulating your patient early and frequently? How might this help? How does this relate to the overall goal of holistic and preventative medicine? Complementary versus alternative therapy. Complementary practice is used together with conventional medicine, whereas alternative practice is used to replace conventional medicine. Again, just thinking a little bit deeper about different interventions that we can do to have that holistic approach to our patients. Some examples of this are aromatherapy, the use of essential oils, which are derived from plants, Reiki, which is a healing technique based on channeling energy into the patient by means of touch, massage, rubbing and kneading of muscles and joints. And on my line of work, I work on inpatient surgical floor, and we give a back massage to all our patients at night, and that can be a great way of reducing stress and pain. Acupuncture. There are several ways to do acupuncture, such as hand acupuncture, electroacupuncture, and transcutaneous electroacupuncture, and auricular acupuncture. An example of how acupuncture can work for patients is that it can treat constipation. There was a study of an article I found that acupuncture was quite effective when it came to reducing symptoms and such of constipation. So it's something to think about. Spirituality. Spirituality is an influential part of holistic care. It is the spirit portion of the mind-body-spirit approach to holistic nursing. An article that I found stated that spirituality gives patients better outcomes. Patients adapt to illness better and recover faster. How they may recover faster is because it gives them a sense of wholeness and hope. It gives them a meaning and value to their lives. It also is thought to reduce stress. Tip. A great way to get spiritual needs addressed by the patient is to refer to chaplain services. Chaplains are not only there to listen to the patient and the families, they're also a way to give the patient some support. They're not there to preach, they're mainly there for a listening ear, which may be all the patient needs. We all know that nursing is busy, but it's still important that we're doing something to get their spiritual needs involved. Conclusion. There are a lot of things we can do to encourage our patients to practice, promote, and maintain health. I hope this PowerPoint makes you think a little bit deeper about what you can do for your patients and maybe think a step farther on what you can do for your own self-care and health. I know for me it has been really huge going over just different interventions and stuff that maybe I don't normally think of or think are important and so forth. It's really valuable to view the patient as a whole. Thank you so much for watching and listening to my PowerPoint presentation. I hope you learned something from it and have any takeaways. Thank you.